karon ako dahil si Nurse Trisha. And kanang mag-head to assessment ko nimo sir ha. Okay lang.
Okay lang, ma'am.
Pwede din mo ingon yung pangalan sir.
Ako din si Dion Nagap,
Birthday nimo sir.
May 20, 1998.
Kasado ka sir?
Adili.
Dili. Sige. Kanang kabalo ka asa ta karon sir?
Nasa hospital.
Unsa tong buhaton?
Mag-head to toe assessment.
Ako vital sign sir ha.
Sige mo.
Say ana sir oh. Tapos close ang bows. Yan. Okay. Relax lang. BP sir ha.
Sige, sige. No.
Pagulit ko sir, kadang ilang. Yan sir. Ano lang sir. Ay, ayaw. Kalma lang sir. Sir, kanang naa kay ma-feel nga mga sakit-sakit sa imong kalawasan karon, problema sa imong kalawasan, or sa ba?
Wala man noon.
Wala ba? Isag ka na sa sakit sa ulo, ana-ana.
Ay, night time tungod sa kainit. Pero dili gid siya always. Sama kung mainitan.
Kung sa kadlaw sir kung magsakit ang imong ulo sir, i-rate daw from 1 to 10 ana.
Siguro nara sa mga
Sa
5.
imong ulo sir,
Ah,
pwede
sige.
gunitan.
Sige lang mo.
Check ko sir ha. Clench akong teeth.
Sige.
Open the mouth sir, Ben. Okay. Sir, nakuha ko na kayo ma-feel nga sakit.
Sige mo.
Na, sir? Sir, ka na mag-check kung mata, sir, ha?
Sige, sige.
Tanaw dodre, sir? Tanaw dodre. Sir, kita ka ato, sir? Pwede di mo, tanaw lang dito, sir, ha? I-check na kayo mata. Sir, kung ears, ha?
Ah, okay, ma'am.
Okay. Sir, sakit mo ba rin?
Hindi.
Dere, sir. Sir, pwede na mo i-cover yung isa dire. I-cover ano siya. Mag-whisper ko dire, sir, ha? Tapos iingon mo kung sa kung whisper, ha?
Okay. Apple. Banana.
Okay. Dire sa pika, sir.
Masses.
May
Table.
problema sa pagginhawa.
Wala man, ma'am.
Kanang sa ilong, sir, ka ng mga nosebleed na batay nga na.
Never pa po ko nakatry.
Mag-check kung ilong, sir.
Okay, ma'am.
Pwede pag-cover sa isa, sir. Tapos cover. Na. Tapos ginhawa. Okay. Tapos sa pikas na sad, sir. Okay. Check ko, sir, ha? Ano na? Pwede na pa-close sa eyes. Tapos simutan na, sir. Okay. Ang saan na siya nga amoy, sir? Sir, mag-check og mouse. Okay lang?
Okay, ma'am.
Okay. Pwede. Parang sarap.
Yung ba sa sulog mo?
Mag-check kung mount, sir, ha? Okay lang?
Yeah.
Igawas daw dila, sir. I-move side to side. Okay. Igawas dila, sir. Igawas na ko ba? Tapos na mo nga, sir. Sir, nakuha ko na yung sakit. Kung sakit. Sakit? Ano, sir? Ano? Kanina. I-move daw yung ulo side to side. Up and down. Ayan, pag-break ko sa mga. Okay. pa-rotate na ko sa ulo, sir.
Okay.
Ano, sir? Ano. Sige. Stop. Tapos, pa-side. Ano? Ano na side? Baba. Hangad. I-reach down ni Dre, sir. Parang ano ba? Ay, kanang lingkod ko doon ka, sir. Straight. Shrug, sir, ha? Kanang kibit balikat. Ano? Okay. Tapos, lingi pa to Dre. Dre. Ano ba? Okay. Tigas na sad, sir. Kasi, pag inom mo na sir. Ano lang sir na, relax lang, relax. Ginawa daw sir. Ginawa daw. Pwede yung ba 99 sir?
99.
Sir, saka na ako kadali mo sa t-shirt.
Okay, ma'am.
Ginawa daw yun sir. Yeah. Saka na sir. Sir, naman. Ulit. Yun daw, 99 sir.
99.
Taas na ito kagbiyak sir na ito sir.
Iyak ko.
Ginawa daw sir. Sir, pwede na makahigda pa ng belet.
Ito sa magpulog, hayang.
Hayang. So, fine. Doon sa ano. Nakalikod, diba? Mag-check to card with sir. Pwede na sa taas. Relax lang sir. Yung ganda mo rin sir. May sandig na rin. Check kung buksan ha. Check na kung rin. Relax ako. Pwede ko makaas mo kung ito tabalik. Okay. Piyong sa sir ha.
Okay, ma'am.
Tapos, igna ko kung nakay ma-feel. Na, ma-feel mo. Na.
Naiyak ko.
Sunod sir, ignatayin ko kung height tolerance ano. Kung saan mo ma-feel ha.
Okay, ma'am. Hai.
Piyong lang do ka dahil.
Okay, ma'am.
Nakaibutang sa imong kamot sir ha. Doon mo kung saan siya. Doon saan siya.
Bad ay kang sensilyo.
Pag sulat ko sa imong kamot, halaan mo kung unsa nga number or unsa kung isulat.
Okay. 3. Wala.
Okay.
Tama?
Yung kada Elsa ha. Pila yung ma-feel?
Dua. Dua na to. Isa.
Yung nagyapon sir.
Okay.
Tapos itudlo niyo mo sa kuha kung asa tayo gunitan ha. Sa duha ka mo. Sabi mo ano ulit sir. Anak. Ato lang tapos pabalik. Tapos mapaspas siya. Basta? And then, kare, itudlo po, gunitan mo, ay, itudlo din mo yung kamot sa kuha. Ana, gunitan mo ilong. Ay, gapon mo. Ana, ulit. Piyong daw sir, das at. Naka-point imong finger. Sa imong finger, aray i-touch siya mong ilong. Matang human. Spikas na sad. Touch sa ilong. Nga na lang buhatan sa mapaspas. So, higa pabalik sa... Pag-check ko dali siya. Hindi on sir. Diba? Relax lang kasi ha. Pagulitan ako sa may sakit.
Slide.
Relax lang. Basta ba naman? Dali sa kada lang.
Ay, salamat.
Tapos, dala. Nakaw daw pa dali sir. Tapos babalik na sa dito. Ay, pwede ko. Yeah. So for the assessment of male genitalia, first you have to introduce yourself, your name, and your role as a nurse. And then you confirm the patient's name and their date of birth or their age, not the gender. Yeah. But anyways, so next is to briefly explain the examination in a friendly manner. Friendly manner kasi we have to establish rapport to our patients. Kasi syempre, examining the genitalia, the rectum, is a sensitive part of the cephalocaudal assessments as syempre tayo pa naman Filipinos, we are so conservative of ourselves, and then we have to show our private parts. That is like a sensitive topic. Next is to gain consent from the patient after you've explained the examination, like ngayon I have to examine your genitals. This will include your penis, testicles, and the surrounding region. After that, after you have explain the examination, you have to gain consent. Like, are you happy for me to carry out the examination and such. After you've gained consent, you have to wash your hands and don your gloves. Explain to their patient that they have to remove their underwear and lie on the clinical examination couch or the bed. Cover themselves with sheet to provide privacy pa rin, syempre. Then, yun, check the genitalia. Ask the patient if there is any pain or such. For the inspection of the penis, groin, and the surrounding region of it, check for the skin changes if there are bruising, lesions, swelling, warts, or and then note for scars if there are any scars in the penis or the inguinal region. And then next is to note for any masses in the inguinal region or the penis mismo. Next, for the scrotum and the peritoneum, ask your patient to lift their penis away, so like paganyan. And then to allow you to closely inspect the scrotum and perineum for relevant signs if there's any skin changes, scars, masses, swelling, bruising, necrotic diseases, ganyan. Next is to palpate for the penis. Examine the penis for some relevant clinical changes. Retract the foreskin, check for penis, and then open the urethral meatus to assess patency. Inspect the glands for abnormalities, and then replace the foreskin once examined to prevent paraphimosis. So for the testicles, if there are abnormalities present in the examination or during the process, or the patient reports any discomfort, perform an examination which includes the normal testicle tests, and then ask the patient if there are any pains or discomfort during the examination. So for the testicular palpation, use both of your thumbs and your index to gently palpate the whole testicle, while your remaining fingers must be placed behind the testicle to immobilize it para hindi siya maggalaw-galaw. And then for the palpation of the testicle, it involves a gentle rubbing motion between your thumb and your finger to examine the whole body of the testicle. And then if you are unable to locate a testicle, palpate along the path of the inguinal ligament for an undescending a scrotal mass. You have to assess if there are any. Assess these masses location in relation to the other anatomical structures. Next is you assess the size of the mass, the shape of the mass borders, the consistency, the tenderness, if may pain while gina-assess. And then fluctuance, transillumination, mag-apply ka ng light dun sa mass. If it is illuminated, it suggests that the mass is fluid-filled. And then cuff impulse, and then the ability to get above the lump, like pag hindi ma kapunta sa above the mass during the palpation, it might indicate na may inguinal hernia. So for the assessment of the epididymis, you have to palpate the epididymis, which is located at the posterior part of the testicle. Tapos ask the patient if there's any pain na ma-feel, kasi if there is tenderness, this might indicate epididymitis, which is the swelling of the epididymis. Next, for the spermatic cord, palpate the spermatic cord from the superior aspect of the testicle using your thumb and index pa rin. Tapos, the spermatic cord should be palpable hanggang sa testicle. Tapos, while palpating, you have to palpate if there are any masses or tenderness. So, there are many tests, including the Franz test. This is used to differentiate testicular pain, which is caused by the acute epididymitis and testicular torsion. Sa test, i-elevate yung testes to assess the impact on the testicular pain. Tapos, ang reduction in testicular pain might be associated with epididymitis. Along this test can provide some clinical value, which is inferior to Doppler ultrasound when trying to rule out the testicle. There's also this assessment of scrotum while the patient is standing. At the end of the examination na kung saan nagahiga yung patient, ask the patient to stand para ma-reassess yung scrotum, and then inspect and palpate the posterior scrotum for evidence of varicocele or hernia. Then after completing the examination, explain to the patient that the examination is now finished and provide them with privacy to get dressed. Tapos thank the patient for their time, wash your hands, and then summarize your findings. After that, you have to explain all your findings, cephalocaudal assessment, to the patient.